Sachusa Namanturana Tui Tabidabonewai, New Zealand High Commissioner, Excellency Madam Dalo, Bulvanaka, distinguished guests, members of the media. Duna turang de una postom na walangi manda duna bei besto in Rabici. First of all, I'm very delighted to be here this morning. To come and commission with the Excellency the new staff quarters for the nursing station at Momi and also the refurbished facility. For those of you who may not be fully aware of the partnership between the Ministry of Health of Fiji and the AMFET, they partner in a infrastructure improvement program, and that has been alluded to by Madam Dalo. It's close to 10 projects so far. Most of the projects have been done in the province of Tailem. And I think for that, I've asked Joe, we can stop with central, then move towards the west, and maybe the north. But with that being said, I've always boasted about this partnership because it works. It has an impact directly on the ground. It's not only doing things, saying things with words, but action as well. So this partnership is unique in terms of AMFET assisting the government of Fiji on its infrastructure improvement program. And like I said, it works. And for that, we are very thankful. And we thank the government of New Zealand through AMFET. Thank Joe Tambua. Joe Tambua has been very instrumental from the start. When I took up this role, my first official commissioning was at Lalabalavu Health Center. And they upgraded it from a nursing station to a health center, I believe. So from then on until now, it is nothing. They've always given their best, and I take this time to also thank the Fletcher Construction. I think they are doing a marvelous work. I believe with the 10 facility infrastructure improvement that they've done, I think they now have a niche for looking after healthcare facilities, and as such, the government itself will now be talking with them for some of the projects ahead. But this is an opportunity to celebrate improvement in infrastructure and also strengthening primary healthcare. That is one of my main commitments, is to strengthen primary healthcare. Because sustainably, in terms of the current issues that we face, we just need to go back to strengthening primary healthcare to ensure that we lessen the outcome and the burden based on financially and the workload at tertiary level. So again, thank you, Madam, on behalf of the Government of Fiji. Thank you to the Government of New Zealand. And thank my good colleague, Joe Tambua, who's been, as I said, instrumental from the start till now. And now it's an opportunity for us as healthcare workers in Fiji to work together. Madam, I look around, I can see majority of the staff sitting here, and I know they wish they'd come across some project like this, because I've worked with most of them, and in a facility, I can say maybe needed some improvement back then, but This is one of the old models of nursing station. It was designed, I've been told this is true or not, it was designed for a nurse to come and work in, and they were not supposed to have a family. Is that true? So it's like that. So that is why that living condition was there. But times have changed, and healthcare services has progressed. And during our visit here with Joe last 2 years, again, we're very thankful that he had identified this place because current nurse, I think she's married here to this place, so she's not going anywhere. They were living at the quarters, also slash working environment. So this is a plus for the healthcare service in Fiji, and also for our dedicated nurse, who, when I asked her last time, she said she's not planning on going anywhere, and she's here to serve the people of Momi, especially the Ministry of Health. And I'd just like also to take this opportunity to thank Divisional Medical Officer, the Sub-Divisional Medical Officers. I know grateful that SDMO Nandi and Singatoka is here. From time to time I've been told that this facility belongs in Nadroga, but it's close to Nandi, so you have to talk it. Oh, okay, good, sorry. And yes, and Fletcher as well. We've done a great job in terms of looking at the progression from Laloa up till now. So again, they have a niche now for looking after and improving healthcare facilities. With those few words, again, thank you. Isajuna turangna tui tamini wai. We came in a drill. Ikan dari singa marutak. Sa may baval tegra tarbo na vali nasi. Avo pagtalangan na bunani bengaray. O kerker me ngo me koni ukuku. Ko kani ukuku moni wararaw tay kemni may moni vangara may moni ni may garan. Na vali ni way ngo na station ko ndol may nawalu kinaba. Don tu walu kinaba. Kembali kau tu mati, so sangat mendengar mu viklar mu presa sesuka ni wala may na waya, muni na may lori kin balsava baingo, ni indong kita pana kalau kau satu kular cengo, sandong bay lorenga irna tu mati nimbi se emergency. Kalau ada mata juga, kalau satu kular muni kako ni damai dolar bangango rei binaka ni gesang ni barangatak mal na inaki wator dek takiti na e vai mbal chup sang wala nga wiki mai matentu materto na matentu ni Islandi batiki hiram don bengara pamimbi sar wiki na sileo dua pada sidon la chunga ni bisinga me ni demuri kemni dakamai jangan ni wararau takana lona taka mate sinilay sarang garan usanu taka ini navaka yang taka baka binaksar na nomuni waliway kon nomuni waliway oni nang garaw tingo kemni oni may garaw bikin oni nang garaw tal tingo kemni kalau may mata tasar juga ada ngeni tuita bira sakay ngol ci may na walis lesi patal nga kina mayaya ni bengaran usanu itaka ini na wararaw ni na redsar wararaw ana buku ni tikin na redwen kina tamata ka din bulan kita matin tu. Ladies and gentlemen, with those few words, thank you, Excellency, thank you, Mr. Tambua, and I thank Fletcher and the Ministry of Health and Medical Services in Fiji.